Hello everyone, welcome to SCube TV. I'm your host Rajni Parara, and today on the show I have with me a very successful psychiatrist. Her name is Dr. Vatsala Wadhwa Thakur, and today on the show we are going to speak with her about psychology and also about mental health. But before, let's welcome her to SCube TV. Hello Dr. Vatsala, welcome to SCube TV.
Thank you, Rajni. Thank you for calling me here and giving me the opportunity to share my views on the topic, which is so close to my heart. It has been ever since I think I can remember.
Yeah, of course. I mean, I can understand that. I can understand the passion and the feeling behind that. And thank you again for taking out time and coming to the channel and doing the show. So, Dr. Vatsala, like I've introduced you to the audiences that you're a successful psychiatrist, but I actually would
I
like
you in
you.
between. I'm a psychologist, basically, not a psychiatrist.
Okay, you're a psychologist.
Yes.
Okay, so you're a psychologist. So, Dr. Vatsala, I actually would like you to, if you can please talk about your journey to other audiences. When did you start psychology and how did you become a psychologist? So, if you can please, talk about that journey of yours and how exciting was it? And because it's a bit of a different stream than
Right.
other streams.
Right.
So, what actually interested you in this field, and how did you actually become a psychologist? You can please talk about that.
Okay. Well, first, I would like to say good evening to all our viewers, and it indeed is a pleasure being here and sharing my views on that. Well, my interest in psychology, basically human behavior, it started at a very young age. I was very intrigued by the way people behaved, Suddenly they are very calm and out of the blue there's an outburst. So it was quite, as a kid, it was like quite unnerving to see people reacting in different manners, out of the blue. So, and then I used to really observe people, how they behave. Every individual was different.
Okay.
Nobody was safe, their behavior, their way of doing things, their personalities, they're always so different. So I was quite intrigued by that, and that maybe pushed me towards psychology. And when I came into starting my graduation, basically I've studied in Shimla. So, and there, when I started my psychology in college, my mentor, my teacher, she was the one. I think all kudos to her who really built in that interest in the subject in me. And after that, it's history. I've went on to do my master's in psychology and then did my doctorate also. And ever since, I've been practicing, and I worked with various schools also, So that gave me a lot of experience in dealing with a varied variety of mental health issues and behavioral issues. Children, there are so many things which we come across, which the children face, like adjustment issues, bullying, parental issues with them, not being able to adjust with their peers. So all these things really, pushed me more towards this field. So, and I remember one incident where in one of the schools, there was this couple. They were very, really hassled by the fact because they were in and out of the principal's office, because they had to be called by the principal because of their child. And it was a new admission. So they did not know what to do. And so when I got to meet them, it came to my knowledge that the child was suffering from autism. So the parents were much unaware of the fact that this also happens. So we did the necessary process which was required. But herein, I felt the need that mental health is something which people need to be aware of.
Yeah, definitely.
We have been from times immemorial. We've been, stressing on physical health. You need to take care of your physical health. You should be fit, go do exercises, drink water, eat healthy. But nobody really bothers about mental health, And everybody is like, it's, you can say, you take it as a second thing. It's fine. Women at home, you see, they go through so much. Children who are dependent on others, they go through so much. So nobody really bothers about what they are thinking, how it is affecting their behavior, how it is affecting their emotional health, what impact is it having on them. So that was something which really pushed me towards, moving more further in this field.
Okay.
So that's how, I've been in this for the last 20 years. And presently I'm working here with the Naval Hospital and taking care of the mental health center. So it's been a great journey and a wonderful, enriching journey, I must say.
I mean, that's a really beautiful journey that you had. But Dr. Vatsala, like I got a bit confused about, being a psychiatrist and a psychologist at the beginning. So I actually would like to know from you that, because, these two terms sounds quite similar. And people normally think that a psychologist and a psychiatrist, basically, they deal with mind and they deal with people's behavior and people's mind, and they treat mind of people. So I would like to know from you, being a psychologist, can you please differentiate between being a psychiatrist and being a psychologist? And also there are, a lot of mental health coach and life coaches are also there in the market, so how are they different from psychiatrist and a psychologist?
Well, psychologist basically is a medical doctor. He's done his MBBS and further specialized in psychiatry, which deals basically in mental health issues. And psychiatrists, they have the, you can say, the power or license to prescribe medication to the people. As well as treat them with therapies, because they do specialize in therapies also. Whereas psychologists cannot prescribe medication.
Okay.
Yes. So we just do therapy, and you do specialize in therapy. So it can be a counseling psychologist or a social worker, or just do a psychology and do various kinds of therapy and become a psychotherapist. So herein, you help the individual bring in change, in his life to deal with his issues, which are related to his mental health or emotions or behavior. That is the difference. And as far as a life coach is concerned, a life coach, a therapist basically, or a psychiatrist also, they basically look into the underlying, reasons, factors, which lead to your present mental health state, or your behaviors, or your emotional states. But a life coach does help you. He pushes you to achieve what you want to do. They help you realize your worth. They help you realize your capabilities, your abilities, and they help you achieve your future goals. So you can say they're more towards they're future based, so that you can get what you want. So they help you in your professional or personal development. It's like that. Though they do part of a psychotherapy also, or do the role of a psychologist also, but psychologists are professionally trained. There are specific hours, where they have to put in, they are supervised, and then they get their licensing.
All right. Got it. Okay. So Dr. Vatsala, so also I would like to know from you, if you can also please clear the confusion out. So if there's a patient who's mentally ill and who's having some mental health problems, so how should they know, and how should they differentiate that, whether should they go to a psychiatrist or a psychologist or a mental health coach or a life coach?
Okay, so see, you need to know how you are being affected by your present state. If I'm so stressed or so anxious, wherein it is interfering with my day-to-day activity, which means there's something wrong with me. I'm unable to do my day-to-day work. I feel lethargic. For example, I'm just giving an example. There are many symptoms as such. So maybe I'm feeling lethargic. I don't feel like talking to anyone. I've just lost interest in whatever I do. So it means that something definitely is wrong with me. And here what is important to know is that if it's just for a day or 2 days or 3 days, just fine. You need your me time. You need time out from your regular schedule. It's very hectic. We all are running a race here, basically. So, but if that goes on for a longer time, maybe 2 weeks or so, and it is interfering with your activity, your daily activity, you're not able to go and work in your office, they're not able to say, for children, they're not able to go to school or cannot concentrate, then like that's a signal wherein you know that you need help. So you can, I would suggest initially try going to a therapist or maybe a psychologist or a counselor or a mental health worker, and that the professional will guide you whether you need medication or not. And if medication is required, then the person will refer you to the psychiatrist.
Okay, so basically um, when you know that, and when you're feeling that you need help in terms of your mental health and you need someone to guide you to make your mental health better, so at that time you should go seek a professional help.
Right. It is important. It is very important. I would suggest that people like your family members, it's for them also, they need to understand the fact, you can always observe that kind of behavior, wherein the individual has lost interest, suddenly there's a change in behavior, he starts becoming too aggressive or become very irritable, or starts crying a lot at small little things. And there are certain behavior patterns, becomes lonely, is not ready to interact, those kind of things. These are signs and signals for you as family members to see that something's wrong with the individual. So just be supportive, ask the person what he's going through, any help he would need. And one thing which is very important, do not give suggestions.
Okay.
That's the most important.
That's the first thing people usually do.
Yes. So if you see somebody sad, the first thing is, why are you feeling so sad? Come on, cheer up. Everything will be fine. That's how all of us do it. But that's not the thing. That's not the right way. Normal is fine. But in case you see these symptoms prolonged in an individual, it's always be necessary to be supportive. Be there for the person. Listen to that person. And when you're listening, it does not mean you're sitting next to the person and you're on your mobile. Be there for the person. Person should feel that, yes, this person really is concerned for me. So sit there, listen to that person, try to understand him. And once you, develop a rapport, the individual needs to start trusting you that, yes, he can confide in you. So once he confides, then just push him towards therapy. Or maybe send him to the doctor also, not an issue. Even your GP, a general practitioner, will also help you, guide you where you should be going. He will tell you, yes, you need therapy, so you need to consult a therapist, or you need to consult a psychologist or a counselor or a psychiatrist. So your GP will also help you in that.
Okay, got it. So, Dr. Vatsala, now that you have mentioned about, looking out for people's behavior, so I actually would like to ask from you that, when we speak about behavior, so there are a lot of people who are introvert and who are not comfortable speaking in front of a lot of people. So, which actually makes a lot of people uncomfortable in front of them. So for an introvert, for all the introverts watching the interview right now or will be later, so what would you suggest? How can they start a conversation, and what kind of behavior can they have when they are sitting in a group so that, they won't make people uncomfortable around them?
Okay. So introverts, there are two types, I would say. Sometimes they are quite anxious being in people. And at times, a person can be introvert, but not be anxious. While he might just love being with himself, love his loneliness, love, reading or enjoying things, doing things. And these people might, like doing things with specific people.
Yeah.
They do not like the crowd.
Reminds me of me.
Yeah.
Reminds me of myself. Yeah. Okay.
Okay. So they love being, in a specific. But you cannot live like that. That's for sure. Definitely. Because man, as we know, is a social animal, and we do need people around us to cheer us up, to keep us going, help us face difficulties. So here, my suggestion to such people would be, prepare yourself. That's one thing very important. If you're going to a party, for example, you can think of something. You can just strike a conversation by introducing yourself. Okay, I'm so-and-so. Or if it's a new person, or otherwise, if you know somebody, you can just talk about things like, what do you do? what kind of work do
The
you do?
introvert person should be the first one to break the ice.
Sorry?
So the introvert person should be the first one to break the ice.
Yes, because it's your exercise you're doing, right?
Okay.
That's the work you're doing. For you are trying to get out of your kind of
comfort zone.
Your situation. Yes. So that is a challenge, and it will really definitely help, I must say. So you can just start the conversation by what you're doing, talk about the individual's interests, what his hobbies are, or you can just mention, oh, I like doing that. What do you like doing? Or talk about traveling, for example. Traveling, I'm sure in today's world, there's nobody who doesn't like traveling. Everybody loves going to places. So that is one thing where you can strike a conversation on. Or maybe sports, news, certain music. Music is one thing, too, which is very common to everybody. So you can talk on that. So these are small little, topics which you can, prior to going to a situation, you should be aware of. Read about it, become knowledgeable, so that you know what to say. It shouldn't be like today, if I'm coming to you and I'm talking, talking to you about sports, but I really don't know anything about it. And there, if you're talking and suddenly I just open my mobile to Google it, so the person will not wait for you to continue the conversation, right?
Yeah.
So therein you have to, be knowledgeable, know what you're about to say. So once you see, knowledge is power. If you know what you can say or what you can talk about, it becomes much more easier for you to converse. So these are small little things. Maybe you can just also talk about something like any crazy thing you've done, Sometimes people do crazy things. So talk about that. And the other person will, that will motivate the person to talk further with you. And you too can just talk about something you've done. So small little things, because introverts generally believe in small talk. They're really not big conversationalists. So, and they don't feel very comfortable. But then, yes, small little topics you can work on so that you can be, you can enjoy yourself when you're with others. That is what an introvert can do.
I think those are some great tips for the introverts out there, who really don't know how to start a conversation and would actually to speak on while they're meeting someone. So guys, Dr. Vatsala have given you some great tips. I think you should follow them. And now speaking of the extroverts who actually, because of their extrovert behavior, they sometimes, land up in trouble and in big situation. So for them, what would you recommend and what would you tell them so that, they can tame themselves down a bit?
Though I wouldn't suggest them to tame themselves, but yes, just gauge the situation. The gravity of the situation. See, if you're in a professional scenario, you cannot be too outgoing or, be very loud. You need to balance everything. You need to measure what is acceptable and what is not. So just have a hold over yourself. So you need to know where you can be yourself and where you really need to hold back. So that is something you can learn, and it does come with practice. You can do it. It is important. Because you cannot just land yourself in trouble all the time. Yes, when you are with your friends, family, be what you are. Just be.
So, according to you, which behavior is the best behavior as a psychologist? Introvert, extrovert, or ambivert?
Well, I wouldn't say anything. Any of them is my choice. But since all individuals are different, their bringing up is different, their family background is different, the scenario where they've grown up, environment is different, or the problems they faced are different. So all these make you basically, So that also determines your personality type. So introvert, I would suggest can just put in a little effort to become a little ambivert, wherein, you are able to mingle in the society and have the best, of both worlds. Be with the society also and enjoy your seclusion also. So that's okay. And for extroverts, they vice versa, they can cool down a little. So ambivert, yes, most of us are ambiverts because we know how to strike a balance. So I think balance definitely makes a lot of sense. And but it is an individual factor, depending upon where what you're bringing up and what environment you've grown up in.
Okay. So also, Dr. Vatsala, when we are sitting in a conversation and when we are sitting with a group or with one particular person, so, it also happens sometimes that people are speaking something, they are, having a conversation, but suddenly it might make the other person or the group of people uncomfortable and they might change their behavior. So what kind of behavior should we look out for if we have made someone uncomfortable? So is there a particular kind of behavior that as a psychologist that you would tell that, okay, so when people have started behaving in these manners and these mannerisms are being shown by other people, so at that time I think you should take a step back and you should stop the conversation.
Yes, because see, all of us, we are born with this. We can make out others' behaviors and we understand what the others, what they are reacting to. So if you are in such a situation, you find yourself in a situation, you made a comment or you've said something as such or done something where everybody suddenly, is shocked and they just retreat. Just be a little humor, use humors, right?
Okay.
So you can just say, oh, maybe it was just, I think I'm being silly doing that, so I'm sorry. That way you can just get over the situation. Or if you feel you've really hurt someone while doing something, I think there's no harm in going up to that person and say, I'm sorry. I think I never meant it, but if you felt, well, I'm sorry for that. It was just, it was just a mistake. So there was no intention.
So basically own up to your mistakes if you have done something like that.
Yes.
Okay.
So that's the best thing,
Yeah.
Both, it's a win-win situation. It's a win-win situation. You realize what you've done, and the other person will forgive you. So relationships don't go for a 6 hours. That's how you can deal with such a situation.
Okay, great. So, you're not a psychiatrist, but still I would like to know from you. So Dr. Vatsala, exactly how we have medicines for, fever, like paracetamol, and also we have medicines for stomach ache, headache. So whenever we go through these pains, we directly go to a chemist. Rather than going to a doctor, we go to the chemist, we buy those medicines and we take them. So do we have any, medicine in particular for mental health if we are going through anxiety, depression, or something like that?
Well, we do have medications for these issues, but see, as I said earlier, this mental health is a very delicate issue here, because if you just start popping in medicines, it will not help you. But if you take medication on a prescription by a professional who has studied, who has been trained in the kind of psychological disorders which are there, and has diagnosed you in a specific manner. Maybe if you have depression, he will give you antidepressants. If you have anxiety, again, they use similar kind of medication. So herein, the professional, the psychiatrist, is the best person who should be giving you medication. I will say it again that do not take over-the-counter drugs. You have to have a prescription for that. It's very important. And as far as stress is concerned, stress generally is not a mental disorder. It's basically a reaction to situations. So it causes a lot of anxiety. A lot of anxiety is there. Anxiety is caused because of fear. You don't know what is there in the future. When an individual, or humans basically, if you see, when they do not have control over certain things, they become anxious because there is fear of the unknown, basically. So that leads to a lot of stress. So herein, to cool you down, to calm you down, you are given medication, but you will never, you should never be taking medication by yourself. None of them, till the time the doctor doesn't prescribe it to you. It's very important to understand.
Okay. So, doctor, you have spoken about, not to take self-medication until unless the doctor prescribes you. So now I also would like to know from you if you can, briefly explain what exactly is psychotherapy. People, when they deal with mental health issues and when they go through mental illness, they go for psychotherapy. Right. So what exactly is psychotherapy? If you can please explain that.
Well, psychotherapy, it's also known as talk therapy. It is a process wherein, trained professional helps the individual deal with his emotional issues or mental distress, so that he can cope with that in a specific manner. So we use basically specific techniques where the individual is helped so that he can live a fulfilled life, and it ensures his mental wellness, and he's able to, heal. That is very important. So as I told you earlier, also like in therapy, the therapist generally deals with the underlying issues. For example, one form of therapy is psychodynamic therapy, which stresses on childhood experiences. For example, a child has gone through abuse. He's been abused, maybe a parental abuse or other sexual abuse, anything. So that does impact a child's behavior and his emotional state. So it can be seen when the individual grows up, as he grows up. So here the therapist goes back, does that work with that patient, and tries to get him out of that scenario so that he can live his life, accepting what has happened, because definitely he's not to be blamed. A child who has been abused is not to be blamed. He's not the culprit, right? So here he makes him accept that, yes, it was wrong, but you are not wrong. It's not your fault. So when the individual gets to know that, he understands the fact, he's able to move on in life. It becomes much more easier for him to, I'll say, adjust to situations in a better manner and experience good mental health. That is. And psychotherapy, there are various types. So basically, we have behavioral therapy, we have cognitive therapy. This is CBT, one form of cognitive therapy, RABT, dialectical behavioral therapy. These are the therapies which we are using. Psychoanalysis, also another form, which is also based basically on the psychodynamic. It's a more advanced kind of therapy. Then we have humanistic, wherein it is basically client-centered, and today's world, people mostly are using that. It is, basically meant wherein the client is more in charge, So the therapist provides unconditional support to the individual. So it helps the individual, take his own decisions. Mostly what happens is when the patient comes to a therapist, he comes with the fact that, okay, as you go to a doctor ke paas ja rahe and medication is given and, I'm cured. So he's going to take the lead. But with therapists, it's not that. In psychotherapy, the therapist provides the individual with various options, basically. Okay, you have a choice here, or encourages the individual to come out with options he is comfortable with and helps him decide. So he's not leading him, he's just assisting. So that is, which is more prevalent now, because everybody wants to do what they want to do, They want to feel comfortable when they are with the therapist, when they're taking therapy. So that comfort level comes when the client knows that he is in charge. Because any one of us would feel uncomfortable when we know, okay, the other person is taking charge. Right? So herein, the individual, when he feels that he's in charge, he responds better to the therapy. That makes a
Okay, great. But Dr. Vatsala, we have very less time. So before I let you go, one last question to you. Does spirituality and meditation also help in the improvement of mental health? Because, a lot of people say that if you're going through mental health issue, you should meditate, you should calm yourself down, and you should, practice meditation. So does it really help, or has it proven by science?
Yes, it does. The mind and the body are related, right? We have one branch in psychology, which is known as positive psychology. So, which propagates that you think positive. I'm sure most of people, and there's so much material on YouTube also for positive thinking, affirmations and all. So, which says that if you think positively, things do happen. It takes care of your physical health also. Right. I'll give you an example. For example, if you wake up in the morning and just say that, okay, my hand is aching today, just try it. It's an exercise you can always do.
Okay.
Try it. And anybody you meet, any of your relatives or friends, they just say, oh, my hand is really aching. And by the end of the day, you feel your hand actually starts aching, It's like that. That is the power of the mind. So it guides your body We had to have neurotransmitters which send these messages all along your system. So positive thought basically helps you overcome your physical ailments also. I've had people, and I'm sure you also must have heard stories where people have healed from cancer also because they had a positive mindset. I've got friends who have actually, I've seen them that happening. So it's amazing, that they've healed by the grit of their, determination and that positive thinking that, no, I will make it, I will do it. They have responded so well to chemotherapy and all the procedures which were done. So it does help. So if your mind is calm, which happens due to meditation and spirituality, I would say, what happens is when you're meditating, you are with yourself. You're calming yourself. You realize it. Your self-actualization comes in. Who I am. Spiritual knowledge is there. You know what a person you are. What are your strengths? What are your weaknesses? You accept your follies also. So where you can accept yourself the way you are at peace with you.
Yeah.
Right. So if I keep saying, okay, I'm not good at that, I'm not good at this, she's better than me or he's better than me. So you're not accepting what you are. Yeah. So once you do not accept yourself, you will always be in a state of stress or, a state of lacking.
Yeah.
Basically. So you'll never be satisfied. So if you're not satisfied, you will not be, physically healthy also because you're not at peace with you. Right.
Okay.
So at times you would have seen people, if they're not able to achieve something, or not able to do something, they will say, okay, that was not the thing, that's why I could not do it. So the blame game comes in. Yeah, that was not, it's not that I did not accept the fact that I did not put in the effort. Right. So those stresses come when your unfulfilled dreams are there. You are not able to achieve what you want. So it does affect your physical wellness also. So meditation and spirituality, it calms you, keeps you in a state of equilibrium, which is very important. This balance is really, really important in our lives, right? So that helps propagate good physical health.
Okay, great. Thank you so much, Dr. Vatsala, for coming to SCube TV and doing the show. It was so lovely speaking with you. It actually felt like a therapy while speaking with you. So it was a lovely conversation and an important educational one too. So thank you again.
Thank you. It was a great experience. I really loved it. Thanks a lot. And wish you many more such successful episodes further on also.
Thank you so much. Means a lot. All right, guys. That's it from SCube TV. Keep on watching and do subscribe to the channel.